morning, fellow staff. My name is Shifa Julius. Before beginning today's in-service, I would like to acknowledge the traditional custodians on the land on which we gather today and pay my respect to elders past and present. I also extend that respect to all Aboriginal and Torres Strait Islander peoples here today. Today's in-service will examine the importance of culturally responsive practice in addressing health inequities experienced by Aboriginal and Torres Strait Islander peoples, also referred to throughout this presentation as First Nations peoples. It will explore how culturally unresponsive practice contributes to ongoing disparities in maternal health outcomes and how culturally responsive care can improve maternal and broader health equity in clinical practice. First Nations peoples continue to experience significant health disadvantages compared with non-Indigenous Australians. Chronic diseases such as cardiovascular disease, diabetes, and chronic kidney disease occur at disproportionately higher rates among First Nations peoples. Maternal and infant health disparities are also significant, with 12% of babies born to First Nations peoples' mothers recorded as low birth weight compared with 6.2% of babies born to non-Indigenous mothers. These outcomes reflect ongoing systemic gaps to access safe, timely, and culturally appropriate healthcare. These inequities are strongly influenced by the ongoing effects of colonization, systemic racism, discrimination, and intergenerational trauma, which continue to affect trust, engagement, and access to health services. Within clinical settings, culturally unsafe practice can negatively impact communication, trust, and engagement. When cultural beliefs and communication styles are not recognized, patients may feel disempowered or reluctant to engage in ongoing care. While these inequities demonstrate the scale of the issue, it also reflects how culturally responsive care practice is experienced in clinical setting. A lack of cultural responsive practice within Australia's hospital is a significant barrier to achieving fair health outcomes for First Nation peoples. This occurs when healthcare systems do not consistently recognise or incorporate cultural beliefs, communication, and holistic understanding of health into care delivery. As a result, patient experiences are negatively affected. Experiences of racism and discrimination also highlights the absence of culturally responsive practice. Reports indicate that increasing numbers of First Nations experience unfair treatment within healthcare settings. These experiences contribute to fear, mistrust, and reluctance to access services. In hospital settings, this is commonly experienced through poor communication and limited understanding. Western healthcare models typically prioritize direct, time-efficient communication. However, it may not align with First Nations people's ways of communication, including storytelling and the use of silence. With maternity and hospital settings, when these differences are not understood, patients feel unheard, disempowered, which can limit their participation in decision-making. Additionally, hospitals may not adequately support holistic models of health, which for First Nations include connection to family, community, and country alongside physical well-being. When these aspects are not acknowledged, care can feel culturally unsafe and discourage engagement with health services. Historical events, including stolen generations, continue to contribute to mistrust in health systems, further reducing willingness to services. Overall, the lack of culturally responsive practice can lead to delayed access to care, early discharge, and reduced adherence to treatment and poorer health outcomes. Addressing this issue is essential to improving trust and engagement, achieving equitable health for First Nations. Moving on, culturally responsive practice is a fundamental aspect of providing care that involves recognizing, respecting, and responding to cultural needs of First Nations peoples. Nurses and midwives play a significant role in addressing culturally unresponsive practice as they are directly involved in patient care, communication, advocacy, and health education. One important responsibility of nurses and midwives is to demonstrate cultural sensitivity, empathy, and respect in all patient interactions. This includes adapting communication styles, allowing time for discussion, and ensuring patients feel heard and understood. Building trusting relationships is essential to improving patient education, continuity of care, and health outcomes for First Nations peoples. The Nursing and Midwifery Board of Australia Code of Conduct states that nurses and midwives must provide culturally safe and respected care while working in partnership with First Nation peoples. This includes recognising and addressing racism, discrimination, and supporting shared decision-making within healthcare interactions. Cultural safety also requires self-reflection and professional development. Nurses and midwives must critically reflect on their own values, assumptions, and potential biases and consider how they may influence care. This is achieved by engaging in cultural safety education that supports the development of cultural responsive care. In addition, nurses and midwives play an important role in advocating culturally appropriate practices involving family and care planning and facilitating access to Aboriginal health services when needed. Through these responsibilities, nurses and midwives can contribute to safer environments with improved health outcomes for First Nation peoples. Addressing the lack of cultural responsive practice requires the implementation of practical strategies within the healthcare environments that ensure respectful, inclusive, and culturally safe care for First Nation peoples. One key strategy is the development of culturally safe environment through organizational policies that promote respect, equity, and inclusion. This includes ensuring First Nation peoples are free from discrimination while their cultural identity is recognized and supported within care delivery. Establishing these environments improves trust, engagement, and continuity of care. Implementing mandatory cultural safety education for healthcare staff is another essential strategy. These programs, supported by NSW Health, enhance understanding of cultural beliefs, communication styles, unconscious bias, ongoing professional development, and reflective practice further supports nurses and midwives in delivering culturally responsive care. In addition, increasing access to Aboriginal health workers and Aboriginal hospital liaison officers is an important strategy within clinical settings. As nurses and midwives, part of our role is recognising when patients may benefit from culturally specific support and facilitating connections with these liaison services. Aboriginal healthcare workers and liaison officers act as cultural brokers between patients and healthcare teams, helping to improve communication, strengthen trust, and support culturally safe patient-centered care. Collaborating with these professionals help ensure First Nation peoples feel heard, respected, and supported through their healthcare journey while promoting more culturally responsive care practices within healthcare environments. Collectively, these strategies are necessary to support the development of culturally responsive healthcare environments and contribute to improve health outcomes for First Nations peoples. Thank you for attending today's in-service. By strengthening culturally responsive practice within our clinical settings, nurses and midwives can contribute to safer, more respectful, and equitable health care for First Nations peoples.